the industries and professions that are growing, or you think maybe growing in 2026? And that's for any of you. Anybody have any thoughts on it?
Well, healthcare is number one. I mean, there's just so many ways to slice and dice that from, caring for an aging population. There's such a wide assortment of roles. You don't have to be, a nurse or a doctor for sure. I mean, there's all kinds of opportunities in that wide range of jobs that are, I used to call them in one of my books, jobs to ride the age wave. And so, jobs people in their 50s and 60s are doing to help care for and make lives better for people 70s, 80s, and 90s. So I think that's going to continue to be a huge job market for people.
Chris, any
It's a
thoughts?
little bit well, it's a little scary how dependent we become. If you take a look at the job growth over the past couple of years, I mean, you just start off with healthcare, healthcare, healthcare. And now that the market has slowed down, it's really healthcare, healthcare, and social services.
Mhm.
So I do think that those will continue to grow. I think there are also opportunities. As always, and I don't think it's just emphasized enough. I know it's not an industry, and that you were asking, but it's small business. And I know small business under a lot of pressure right now. But when we're talking about older workers and getting jobs, a lot of those jobs are just going to come from small businesses. People that you've known, perhaps you're a customer at the small business, perhaps you worked with them, but really looking into the small business opportunities that are available in your neighborhood, in your area, in your community. And that's where a lot of jobs are going to come from.
There's not so much a question, but a point from the audience that I want to hear your thoughts about, all of you, which was somebody wrote in, boomers need to define their value proposition more than just sending in a resume. I'm wondering, anybody want to talk about that a little bit? Carrie, maybe you want to start?
Well, I think without question, but I think that should have always been a part of your job hunting mojo is how you can solve that employer's problem with your unique perspective and your skills. And so when you're in that interview, you're not saying me, but you're saying, I've seen this situation before. I recognize this. This is how I've solved this problem in the past, or I've seen it solved. But it is exactly that. That is critical, your value proposition and how you have the, know how to take care of that right off the bat. One other point I want to make quickly about what Chris was just saying also is when we say healthcare, that doesn't mean, I mean, you could be an accountant, you could be a project manager. It can be any of the skills you had in your previous job that you apply to these industries, those small businesses that need experienced workers who can pop in. Maybe it is just once a month or twice a month or contract, but this is where the job opportunity is going to be. But it can be right in your own wheelhouse. It's just in that industry.
So you're working in healthcare, but you're not necessarily a doctor or a nurse.
Precisely.
Yeah. Catherine, what are you hearing from employers about what they're looking for if they are hiring at all this year? And it could be part-time or full-time.
Okay, and this is more anecdotal than survey-based. Because I want to acknowledge the frozen situation, but employers are still hiring. The economy and the workforce, it continues to be dynamic. I have come across just in my travels employers that are having a really hard time finding people, and so they are out there, and it is especially in areas we've touched on healthcare, but I'm going to call it industries related to population aging. And we've got a critical mass of baby boomers who are getting older. We have the silent generation who's getting even older. They need access to products, services. It could be types of care, but things people need. And first of all, it's a big opportunity for entrepreneurialism, but also for employers to be able to attract people to work in those types of businesses. They're having a tough time. So it isn't necessarily being a doctor or a nurse or a nurse practitioner. It goes beyond that. A growing part of the population that has a demand for products and services, some of yet which to be invented, that is just not there. There's greater demand than there are such services and supplies available and employees or workers to be able to fill those jobs.
We just have about a minute left before I'm going to turn this back to Doug, and there are two questions that I wanted to be sure we got to. One is question, and maybe this is mostly for Catherine, but feel free, Carrie or Chris. Why aren't more employers doing more to help older adults find work or to phase into retirement? I know you've talked a little bit about phasing retirement, but it seems like not that many are saying that they're doing very much for people as they get older, and it's particularly about working in retirement. Basically, they're saying, well, what we're doing is we've got a 401k. That's all we need to do to be helpful.
Okay, and I think if we step back and look at employers, they're navigating they're navigating the economy, their own profitability, a changing environment, their own workforce, and as things in their totality. That topic may have not risen to the top of their priority list, but I'm optimistic. I see the indicators that employers are realizing here's untapped potential, an important part of our workforce, and we want to attract and retain those employees. And I will say, in terms of helping workers prepare for retirement, many employers that we've surveyed, in fact, a majority, do feel some responsibility helping them. But I do want to leave you with the disconnect, because this is just coming to mind with our AI conversation, is we're seeing large numbers of employers saying they're implementing AI or they've already implemented it. However, they are falling behind on their professional development programs, meaning that they're implementing new technologies, but they don't necessarily have the training programs in place to be able to really leverage those with a workforce that knows how to use them. That applies for older workers, but it also applies to workers of all ages. So that's a big sort of employer-worker disconnect. And it's an area of opportunity for job seekers if you can help bridge some of those gaps.
Thank you. So let me just close my part before I turn it back to Doug with a final question that actually comes from Doug. And it's really something that I think a lot of people in our audience will find helpful. And that is, what should professionals and groups that are supporting older workers and would-be entrepreneurs be doing to support their clients in this environment? Anybody?
I would say the number one thing is, if there's any way you can get older workers in front of employers who are looking for workers, if there's any sort of meetup, a connection where they can actually, it's not just in the Ethernet, but a real situation where employers can actually meet potential employees, and then also skill building opportunities, virtual learning opportunities are critical. But I just think that the magic happens when you can actually connect the employer with the worker, the employer who has opportunities with workers looking. It doesn't have to be individual meetups, but some way of getting them together.
Chris, any thought?
So I just, agree with that very much. But the other thing I just gave a talk recently, to the local Rotary on this very topic. And I think getting out there, and I'm sure everybody does that, but getting out there in the community and the Elks group, the Rotary, all these groups that have small businesses there, and tell this story and get the message across and answers people's questions, and then get their cards. And then when someone comes to you and says, I lost my job, or I'm looking for something more to do, you can send them to some of those people. But I think this is part of going to the institutions in your local community that can make a difference, who have hiring authority, and who may basically have not gotten the message. And that was what I learned from some of the conversations that I gave recently here in the Twin Cities.